Hello, I'm Dr. George Siegel, past president of the Society of Nuclear Medicine and Molecular Imaging. Medical imaging has transformed the way physicians are able to diagnose and treat a wide spectrum of diseases. From X-ray to ultrasound, CT and MRI to nuclear medicine and molecular imaging, we've come a long way, but now we can go even farther. Moving beyond static anatomical images of the organs that only show structure, nuclear medicine and molecular imaging give physicians access to unique information about how organs are actually functioning. This additional information allows us to create, monitor, and tailor treatment plans for patients that can result in better, safer, and more cost-effective care. Nuclear medicine and molecular imaging are safe, painless, non-invasive alternatives for diagnosis and treatment. In the next few minutes, I'll highlight several specific examples of how nuclear medicine and molecular imaging are helping patients with cancer, heart disease, and other diseases. For a patient with cancer, a positron emission tomography scan, or PET scan, is invaluable to help stage and assess treatment. With an anatomical scan such as this one, we can only see that a mass is present in the body. However, with a PET scan, we can tell whether the cancer within the mass is growing, shrinking, or even eradicated. This is critical information for treating a patient. In fact, a recent study from the National Oncologic PET Registry shows that 37% of physicians change their treatment plans as a result of PET scans, eliminating ineffective, costly, and perhaps painful treatment. Patients with heart problems can often benefit from a SPECT scan, which stands for Single Photon Emission Computed Tomography. Tests such as coronary arteriography are able to show where there are blockages in the blood vessels. A SPECT scan, however, can examine how effectively the patient's blood is reaching the heart, a valuable tool for assessing the risk for heart attack. Many times, a SPECT scan can provide useful information about the appropriateness of coronary artery bypass surgery and whether surgery is needed. Nuclear medicine also includes several types of cancer treatments, such as radioiodine therapy and targeted radioisotope therapy, or TRT. TRT is an extremely effective way to treat specific types of lymphomas, providing targeted treatment that affects only the cancer cells without harming surrounding tissues and often leading to long-term remission. This extremely targeted technique is now being investigated for use with other types of cancer. With nuclear medicine and molecular imaging, we can tell within weeks rather than months whether a treatment is working. We can increase the effectiveness of necessary surgeries and reduce the incidence of unnecessary surgeries. Nuclear medicine even provides an effective, non-invasive alternative for treating cancer that isn't responding to chemotherapy. It's pretty amazing. To find out more about nuclear medicine and molecular imaging, go to www.snmmi.org.